I'm Dr. Rick Capusta, school psychologist and also licensed clinical psychologist. My topic for today was working as a school psychologist and clinical psychologist in different settings. Well, I appreciate you coming today, and also appreciate your interest in learning a little bit more about psychology as a potential career. I became interested in psychology as an undergraduate student. Like many students, when I graduated from high school, I really didn't have a clear idea as to what I wanted to do. Math had always come rather easily to me, and I enjoyed math, so I actually began as a math major as an undergraduate student, took my first course in psychology and was really interested and started taking more and more courses in psychology, and then changed my major. So my undergraduate degree is in the area of psychology. As Mrs. Michael said, I'm a licensed clinical psychologist. I'm licensed for private practice here in the state of Pennsylvania. I was also licensed for private practice in the state of California for a number of years and maintained that. My wife and I were contemplating a move to San Diego, but that didn't happen, and so I haven't maintained that license. As a clinical psychologist, I worked in a number of different settings. I operated a private practice for about 7 or 8 years in Mount Lebanon, where I specialized in treatment of children and adolescents, saw many clients with presenting problems like ADHD, anxiety, depression, adjustment disorders, disruptive behavior disorders. And I would do individual therapy. Some clinical psychologists do group therapy. My training was with individual therapy. And then I would also work with the parents on some strategies for behavior management or ways that would be very appropriate in dealing with their students. Most of my work experience, though, has been as a school psychologist. So in addition to being licensed for private practice in the state of Pennsylvania, I'm also a certified school psychologist in the state of Pennsylvania. And as a school psychologist, I've worked primarily in the school setting, but I've also worked in a residential treatment facility. I've done some research, and I'll talk with you a little bit about that as well. So some of the things I wanted to touch on today are level of training, education and training required to practice as a psychologist, to be recognized as a psychologist. Secondly, roles and functions, particularly of the school psychologist. Talked a little bit about the clinical psychology setting already. And I also want to talk a little bit about some of the traits, what might attract people to psychology and what kinds of traits would make a good fit for you to work in that particular field. And I also want to talk about the various settings in which, as a certified school psychologist, one might work. For clinical psychology, licensure in the state of Pennsylvania is at the doctorate level. So you're looking at getting an undergraduate degree. Typically that's in psychology. And then beyond that, you would be attaining a doctorate, which is anywhere from 4 to 6 years beyond the undergraduate degree. As a student, generally that includes setting in an internship for probably about a year. There are 2 tracks actually to being a school psychologist. One is, well, first of all, most school psychologists have undergraduate degrees in either psychology or education. And that's important because clinical psychologists are trained specifically in the clinical areas, so they take a lot of courses in abnormal psychology, courses in adjustment, personality, and counseling and psychotherapy. School psychologists are unique in that their training is highly intensive training in both clinical psychology as well as educational psychology. So the clinical psychologists aren't as knowledgeable about things like learning theory, educational psychology. So to get back to the criteria, the two tracks are, one is 60 degrees, 60 graduate credits after your undergraduate degree. So you'll get a master's, and then you'll get what's called a certificate of advanced graduate study. Part of those credits, it's not all classroom credits. As you get toward the end of your program, you'll do a year's internship in a school setting typically, and you'll earn credits for that as well. The other program, and we're seeing more of this now, when I was doing my training in the Pittsburgh area, there weren't doctoral programs in school psychology available, so I did my training a little differently. And but currently there are doctoral programs which are like 90-degree programs. So when you finish up with your doctorate program, you'll have your certificate of advanced graduate study, you'll have a master's degree, and you'll have your doctorate. The advantage to the doctorate is that you would be eligible to provide private practice. A number of school psychologists are interested in working in a private practice setting, so you could combine those two areas and be not only certified to work in the schools, but licensed as a psychologist. So that's the training that's involved. Looking at the settings in which you might work. Most school psychologists work in a public school setting. Other settings in which we might find school psychologists would be private school settings, parochial school settings, the university setting, and the research setting. I've done some work at the university level. It's been strictly teaching. I've taught courses in personality and adjustment, advanced learning theory, and assessment and prescriptive teaching. If you were a full-time professor at a college or university, in addition to teaching courses, you would also be doing research, as well as advising students. As an adjunct faculty member, I did very little student advising. I would just come in and teach the course that I was assigned, and did not do research as part of my position there at the university. The other setting that school psychologists work in is, or clinical psychologists, is a research setting. I was hired as a clinical psychologist for 2 studies. The first study, anybody here familiar with the medication Strattera? No. Well, Strattera is a relatively new medication to treat symptoms of attention deficit hyperactivity disorder. Most people who have been diagnosed with ADHD, if they're going to be medicated, usually the first line of medication are stimulant medications, like Ritalin, Focalin, things along those lines. Sometimes that medication doesn't work effectively for people, and sometimes there may be side effects to that. So when that drug was being approved for the FDA, they had sites across the nation. And I worked in one of those sites, and I would interview with strictly adolescents on their symptoms and how effective the medication was in treating their symptoms of ADHD. And I did that. I followed those study patients for about 7 years. And at the end of that time, Strattera was given FDA approval. The other study in which I was involved was with infants at 6 months and 12 months of age. I assessed the mental development and the motor development of children, and working in a team with pediatricians who were looking at illnesses, the growth of the child, and other kinds of developmental milestones. And the purpose of the study was to look at the differences between babies who were breastfed versus babies who were bottle-fed with formula. And at the end of the study, what they had discovered was that there really was not a significant difference in the factors that they were assessing. And then when they did what's called disaggregating, which is you look at different populations within that. So they looked at children that were born preterm, and they actually in some areas did a little better on the formula, which was augmented with, I think they said, long-chain fatty acids. So I'm not really familiar with what that means, but that was the difference. So those are the different settings from my own experience. Like I say, most of my work has been as a school psychologist, and the tasks that I have as a school psychologist, one of which is assessment. So if children or students are presenting with academic problems, social problems, emotional, behavioral adjustment issues, I may become involved with that. And sometimes I'll team with the counselors, sometimes we'll team with classroom teachers, and we're looking at, in the assessment process, to determine what is perhaps the underlying factors that are causing a student maybe to be performing poorly academically, or to be evidencing some emotional or behavioral adjustment disorder. The assessment involves the psychologist oftentimes meeting individually with the student, and we may administer psychological tests. So we may be looking at measures of intellectual or cognitive ability. We may be looking at academic skill development. Here we're looking at possibly learning disability that a child might be having that could be contributing to their issues. We also do self-report measures for anxiety and depression, where the student would fill out a self-report form, and we would assess that in terms of, is the student actually evidencing signs of either anxiety or depression. Other data that we collect would be possibly behavioral assessments, where the student's classroom teacher and parents would independently complete rating scales, and we can score and analyze those. And when we're doing these assessments, we're working with a team. So someone on the team might be observing the student within the classroom. The parents provide information for the evaluation, so it's very comprehensive. We end up doing, I probably do about 2 assessments, maybe 2 to 3 assessments every week of students. We also provide consultation and collaboration services. So we have what's called pre-referral interventions, wherein we meet with the student's parent, the classroom teacher, the principal, and maybe a reading specialist. We talk about issues that the student is having, and we put together an action plan, which is a way of providing early intervention services to help the student with whatever issues they're experiencing. And then the team will come together in another 30 days and we'll review that and see what kind of progress the student is making. If after 30 or 60 days we're seeing that the student is not responding to the interventions, we may then go the route of an assessment. Part of the reasons for the assessment is to determine if the student needs something more intensive in terms of their educational placement and programming. We also provide in-service training to the staff. So we might be presenting at some of the Act 48 days and providing teachers with information about different disabilities and ways that teachers can respond or even recognize if a child might be depressed in the classroom. What are some symptoms that we might see in that regard? Counseling services or mental health services are another area that school psychologists provide. In this particular setting, and actually in Western Pennsylvania, the model is a little different, and that most of the schools have school counselors and school social workers who provide those services. It's not typical for the school psychologist to provide that. That's one of the reasons that I did go into private practice, because I missed that part of providing individual therapy to children and adolescents. And so that provided me an opportunity to do that. I have a friend and colleague out in Arizona. Their model is completely different. They have larger numbers of psychologists, fewer numbers of counselors, and so the psychologist, part of their role in addition to doing assessment, consultation, and collaboration, is to provide group therapy and individual therapy.
What would be an example of a time that we might call you?
Well, it might be when a student is having some significant issues wherein they might be in need of special education services because they're failing, and we're also seeing maybe some emotional and behavioral issues. I also get involved in crisis intervention. So if a student is thought to be at risk for harming themselves or others, I would be called in and do a threat assessment at that point. So that's another role of the the school psychologist.
Sometimes for a tragedy.
And for a tragedy as well. If we have maybe a death of a student or death of a family member of a student, we come in and we provide supportive services, counseling support to, well, actually not only the students, but I've also provided that to teachers and paraprofessionals depending upon the nature of the incident. So one of the things that I find to be attractive to me in my role is that no 2 days are the same. It varies quite a bit. And my assignment here in the district right now, that's where I'm working full-time in the district, and I still maintain a small part-time private practice, but I provide services at the high school, 2 of our elementary schools, and then Neil Armstrong Middle School. One of the other things that we do in assessment is I evaluate kids for the gifted program, enrichment program. Yes?
I wondered how many students you have and how many school psychologists are at Bethel, because I think maybe a lot of the students don't know.
Yeah, there are actually only 2 of. How many of you knew we had a school psychologist? Okay, that's a pretty well-kept secret. There are 2 of us for the district, and what are there, 4,500 students in the district roughly?
Roughly,
So,
5,000.
yeah, so we've got maybe 1 per 2,500 students. The recommended ratio is 1 per 1,000, and very few school districts have that. And those that do are like in Arizona, where the psychologist is doing other kinds of roles than what they might do here. Salary, that's always an important thing. The average psychologist across the nation makes about $75,000 a year. This is school psychologist. The range, starting out, the starting salaries in this local area is about $50,000. People with experience who have the doctorate degree, they could be making as much as $110,000 or more. The time schedule for you, some school psychologists work just the school calendar. So when kids are in school, the psychologist is working. Many have extended contracts where they may do 10 or 20 extra days through the summer. Some are 12-month employees. So they're here throughout the entire year and have so many days for vacation. Questions that anybody has? Yes?
What's the job outlook for school?
That's a good question. The job outlook for psychologists, there are more training programs developing, and I would say that the job outlook is fairly good, especially if you're willing to relocate. There are certain states that really are looking for psychologists. I had a student who did a practicum and shadowed me for a while. She's finished her degree. She's working in Colorado, and she had no difficulty getting a job. She was hired within 3 or 4 weeks of her graduation. But if you wanted to stay here, it's a little tighter in this area because people usually get these jobs and they stay in them until they retire.
Probably pretty competitive, so definitely want to be making good grades in college.
Well, it is. I mean, just to
There's only 2 of you.
right, and just to get into the graduate program, that's pretty competitive as well.
We have a diverse population here, so when Dr. Caputo is referring to undergraduate, that's how many years? You guys know? 4, right? 4 years. So your undergrad, you would major in psychology or what were some of the others? Education, and then you would have to go an additional 4 years for full psychologist. Is that 4 to 6?
It's probably about 4 years. You could do it in 3 to 4, depending if you went summers,
Okay.
which I did because I was anxious to get out and start making some money.
So we're talking 8 years minimum of education
Pretty typically, yeah.
afterwards. And what schools around the area would you recommend with good school psychology programs?
Well, one of the schools that does give you the option of the master's degree and certificate of advanced graduate study is Duquesne University, and I work cooperatively with them where we have practicum students come and work with me, or first-year doctoral students are here in the district working with students providing some support. CalU also has a program, and IUP. So those are the ones in the immediate area that have school psychology programs. Penn State has a good psychology program as well, and our conferences for Pennsylvania, Western Pennsylvania, they're held at Penn State. They were actually one of the earlier universities to have the school psychology training program.
Okay, so Cal U, IUP, Duquesne, Pitt, Penn State,
Mhm.
a lot of the local schools have good.
Well, currently Pitt doesn't have a school psychology program.
Okay.
Yeah,
Or even-
yeah.
What kind of psychology program does Penn have?
Pitt has programs in educational psychology, and I also believe they have a program in social psychology. So we have a variety of different kinds of psychologists, and depending on where you want to practice. If you're interested in working with children and adolescents, working in the schools as a school psychologist is a nice option. When I was doing my private practice, I would work in the mornings in the school settings or the hospital or residential treatment settings, but then I would have a break in my day, and then I would start seeing clients in the afternoon through the early evening. So it was kind of a split day. And if you want to just work like normal work days and you want to work with children and adolescents, working in the schools is a good option.
I think a lot of students don't realize if you are a clinical psychologist in private practice, your hours tend to be accommodating
They do.
the population. So you're working a lot of evenings and weekends.
You
Would
are,
that be
very much.
correct?
I worked a lot of Saturdays. I worked usually Monday through Thursday in the evening, sometimes as late as 8 or 9 o'clock. And you're also, your income comes from billing insurance companies primarily, whereas you're not, if you're working in the schools, then you're a paid salary employee.
So there's pros and cons to that.
Absolutely,
To think about.
yeah.
I think a lot of students, one of the big things that we hear is students coming in and saying they want to be a psychiatrist. Can you explain the difference?
Absolutely.
Of psychologist versus psychiatrist.
Psychiatrists are medically trained first, so they go to medical school, and then following completion of medical school, then they specialize in psychiatry, much as your orthopedic surgeon specializes in that particular area, or pediatricians specialize. So and they are, psychiatrists are licensed and trained to prescribe medication. When I worked with the study on Strattera, that was the pediatrician there that actually prescribed the medication. Part of my assessment, my job was to recommend whether or not we should increase the dosage, and the dosage was based on relationship of the child's weight, and but the psychiatrists are the one who prescribe the medication. A lot of their work is medication management, and some of them do treatment, but oftentimes in that setting, the psychiatrist supervises the case, does the medication management, and then will have a social worker or a licensed counselor or a psychologist in that setting doing the actual counseling or psychotherapy. Provided you with the case study, and I just wanted to take a few minutes here to review this. But first of all, any other questions before we move on to that? I want to make sure I address everybody's questions. Okay. Looking at what we've learned today, and just to kind of go through a simulation of a case, we have Sarah here, who's a 14-year-old female, currently attending the 9th grade at a large public high school. Previous to this current school year, she had attended a rather small parochial school where she had excelled academically, earning A and B grades each year, dating back to the elementary school years. This year, her grades have dropped significantly to below average and failing grades. She's frequently absent from school or late in arriving. Her school assignments now are poorly done frequently or incomplete. She keeps to herself, where previously she was a friendly and outgoing student, rarely volunteers during class, and when she's in class, she appears distracted and upset. She'd been an avid soccer player, but has recently dropped from the team. So, let's talk first off, what are the presenting problems? What are the concerns? What, yes,
That her grades dropped and she's not as outgoing as she used to be.
exactly. So we've got a decline in her grades, her academic performance has dropped. She's becoming withdrawn socially, which is a change behaviorally with Sarah. Any other problems? Yes.
She's not social.
She's
and she dropped from the soccer team, and it seems like she has no friends. who are
Right.
there for her.
Exactly. Okay, so some other aspects. So, if you were assessing this student, based on what we talked about with assessments, is there anything additionally you might want to know about Sarah to help you formulate the nature of her problem? What other information would be helpful? Yes, sorry.
Maybe what's going on in her home life.
Okay, is there something going on in her home life? Is there a change there that she's reacting to? Anything else you might want to know? Yes?
If she's taking like any medication.
Yeah, is she on any medication? And could she be reacting to the medication, or is she on the medication for maybe some of the issues that she is showing? Anything else?
Medical info?
Medical information, right. Now, when you're collecting information, who might you want to talk to? Talk to the doctor? Who else?
Parents.
Talk to the parents and the child's teachers. So we start to gather more information about what's going on at home. Have the parents seen changes in the behavior? Are they concerned about what they're seeing? Is there, as you had asked earlier, anything going on at home? So we could collect additional data through interviewing. Would we need to assess this student? Would the psychologist need to meet with this student? What do you think? Yes? Yeah. And what kinds of things might the psychologist might want to know?
How she feels maybe about attending a large public high school versus a small private school, and how she feels like she changed.
Excellent, because could it be related to the fact that she was in a small school where she was popular and she was doing well academically, and now she's made an adjustment? We know from research that some of the most significant adjustments for school-age students are relocation of family, change of schools, and death of a family member. So this is a pretty significant stressor for her, and it may be contributing to this. So, what might you think the causes could be? Yes.
Maybe she's not comfortable with her environment.
Okay.
She used to probably have a lot of friends, and now she's at this new big school. She doesn't know anyone, doesn't feel comfortable.
Very good. Yes. So she's in a new setting. She doesn't know anyone. She's not comfortable in the new setting. Anybody think that she might be depressed? Yes. What would give you that idea?
Because she always seems upset, and she obviously has no friends, and she's not involved in anything. I mean, I'd be depressed too.
Yeah, absolutely. And what happens too, if we look at some of the symptoms of depression, social withdrawal is one of them, being upset, declining school grades, not coming to school late. These could all be symptoms of a depression. Yes?
Would you also ask her about her appetite and her sleep?
That would be very important to know too, because those are two other things that can be impacted by possible depression. And so we want to gather as much data as possible. In this sense, if we did decide we wanted to do some assessment beyond the clinical interview with her about her symptoms and how she's feeling and what her thoughts are at this point in time, because people with depression generally have negative thoughts. There's something called a negative triad, where they have negative feelings about themselves, negative feelings about their experiences and how they interpret their world, and negative experiences about what's down the road, what their future is going to be like. So we might also want, in addition to interviewing them, maybe we want to do some depression scales. Administer maybe the Beck's Depression Scale or the Reynolds Adolescent Depression Scale to see is she reporting symptoms that would be typical for depression. We also have behavioral rating scales that parents and teachers complete that help us to understand whether a student might be depressed. So let's say that after we do our assessment, we come to the determination that, you know, Sarah's having some difficulties with adjusting to the new situation. She seems overwhelmed, and we determine that she does meet criteria for clinical depression. What might we do? What might we recommend for her? Yes?
Maybe, since she enjoys soccer, tell her to get involved with soccer again. She might be able to make friends on her team and just get more involved with school and
That's an excellent suggestion, because sometimes what happens is if you're doing something called cognitive therapy, cognitive therapy involves homework. So you have the client go out and do certain things. So you might have her do an activity schedule and say, okay, your assignment is to go out and find something that you want to do, and then maybe keep a little journal about your level of mastery. How well do you think you did with that? What were your thoughts and feelings about that? So, and the more you get involved, the worst thing for somebody depressed is to socially isolate, because people just kind of ruminate. But if they are out and involved in the community, doing things that, especially things that gave them pleasure in the past, because that's the other thing you would ask them, not only to rate their mastery, but their pleasure. How much did I really enjoy this? So other possibilities. What are other things that we do for people who are depressed? Yes?
Prescribing antidepressants.
Yeah, so maybe we're going to recommend them to see their primary care physician or to see a psychiatrist to see if maybe some antidepressant medication might be helpful. We usually try treatments short of that, but that's a very good suggestion. The other thing, and it would be the psychiatrist that would make that determination. Another thing would be to have them become involved in counseling. The school will provide school-based supportive counseling for kids, but oftentimes it's important for them to develop a relationship with a therapist outside of school, to see them regularly, because that's kind of a more long-term kind of thing. And it could be intensive, where you're seen, you know, once or twice a week. So, other questions that anyone has? Yes.
There's a black box warning on a lot of the antidepressants for kids, and counselors would have questions about that. Can you talk about that? And I don't know if you've heard that or not, but what is that?
Well, some of the black box warnings, I remember when we were doing the study on Strattera, and what they were finding was that some of the adolescents, and these are students who've been diagnosed with ADHD, were experiencing thoughts about harming themselves. And so that was being investigated. It was a very small amount, but what we did was we met with every study patient, myself and the pediatrician, study patient and the parent, to determine whether the student was experiencing, what we referred to them as study patients, were experiencing any of those symptoms. Some medications are researched and FDA approved for adults, but then you also have where psychiatrists or primary care physicians will prescribe medications sort of kind of off-label, so that maybe it's an adult medication, but they found that it is successful with adolescents. So even if the research hasn't been found to support that, then the student may have a trial on the antidepressant medication.
We just kind of have to be careful with prescribing medications.
You have to be very careful in prescribing medication, especially if you're using the medication off-label, and that's why typically the prescribing physician or psychiatrist will want to see the patient back in a very short period of time. With antidepressant medications, it generally takes 3 to 4 weeks before those are to such a level in the system to really become effective as alleviating symptoms. And sometimes you have to try different kinds of medications as well. In the school setting, obviously we don't prescribe medications, and we might suggest that a parent might want to make a consultation if we feel that that's something that needs to be looked at.
Questions?
Anything further?
About challenges in the job, what would you say, besides the caseload, which I'm sure is.
The caseload is the greatest thing. The other thing that we have is timelines, so that when a student is referred for an assessment, we have 60 calendar days to collect all the data that I talked about, see the student, do the assessment, write up the report, and get that to the parent. That's monitored through the Department of Education, so it's very critical that we do that. So it can be stressful at times because of the caseload, and some of the cases that we're dealing with can be stressful. Sometimes we have students who come and present with a need, but the parent may not agree, and so you're dealing with that. You're also dealing sometimes with conflict. You had mentioned earlier what's going on at home. Maybe there are some issues at home, and so there can be a certain level of stress associated with the job. Going into meetings that you know or there's going to be conflict, and you're going to have to resolve that conflict, mediate it. There's also, I feel, a lot of rewards for the job. One of the things I find particularly rewarding is that I might see a parent that I had worked with their child maybe 3 or 4 years ago, and they'll come up to me and thank me for the support and let me know that their student is maybe in college now and doing really, really well. So those are the really rewarding aspects of the job. In terms of traits, I started to talk a little bit about that. There are certain theoretical constructs that talk about people's traits relative to jobs. There's something called the Hollins Codes that look at what traits that you have that would be a good fit with the job.
If you're a junior, you've done that with me last year.
Okay. Any of you who are high in social and investigative, those are the psychologists, because the social part of it is the helping part of being a psychologist and being interested in working with other people. You know, some people don't like to work with people. They'd rather work with things. And then the investigative part of it is the analysis. So when you're doing these assessments, there's a lot of quantitative analysis of the data that you collect to determine if the student meets criteria for disabilities. Okay.
Last minute questions? Okay, if you came in a couple minutes late, do make sure that you sign in on the sign-in sheet. I'm not sure. Oh, it's on this table right
Thank you for your attention. If anybody has any further questions, please let me know.